Next from Champaign, Illinois Channel correspondent Dr. Allison Jones talks to PhD Norman Paquin about a new school opening at the University of Illinois at Urbana-Champaign that will apparently revolutionize the teaching of medicine. This runs about 10 minutes.
Norman Paquin, thank you for joining us on the Illinois Channel.
My pleasure.
So we're very glad you're able to join us this evening for this educational program for our physicians. And I'd just like for you to have an opportunity to share your history of involvement with the new College of Medicine and your vision for the future with it.
Well, so I am been the project lead for this new College of Medicine for the University of Illinois for about 2.5 years now. Was approached by the provost and the chancellor back then to take on this project because I'd been involved with setting up some major initiatives within the campus in the past. And I was glad to accept. I mean, I think this project has been one of the most rewarding ones for me to pursue because it has such potential to change our community, to have such a fundamental impact on medical education. And of course, it also taps into some of my expertise, which is engineering and physics. So it's really been a delight to work on.
So that's fantastic to hear. I really wanted to give you a chance too. What type of projects do you currently work on with your engineering background on campus now, and how do you envision those may be incorporated into some work with the new College of Medicine?
Right. Well, so I'm in my official job, I'm an associate director for research in one of our interdisciplinary units within the College of Engineering, called the Coordinated Science Lab. That laboratory specializes on interdisciplinary projects to have meaningful societal impact by leveraging core expertise in information science and technology. And within CSL, we actually have a engineering healthcare systems center, which is looking at the application of robots, simulation, big data, information science to solve medical problems and healthcare problems, to essentially bring, very much like the vision of this college in terms of finding ways of bringing better health outcomes to more people at lower costs. And it's, I think one of the things for me has been the pleasure of learning about some of the research projects that are already underway within our college and elsewhere on campus to pursue those goals. One of the examples I really think about is that we have a professor who is developing some nanotechnology, using nanotechnology to develop ways of testing blood to detect cancer and potentially providing an interface to a cell phone so that these people could do these type of tests at their home when they want to, as opposed to having to go, as they do now, go to a hospital for an exam that requires two very specialized technicians, a $50,000 machine, and then have to wait 2-3 days before you get a result. I mean, those are the type of things that you can sort of see could transform healthcare. We also have other projects which involve the development of advanced telemedicine techniques, professors working with hospitals for our veterans and so on, working with physicians at those hospitals to, again, develop new ways, right? So that when we have veterans like we do here who live 100, 200 miles away from a veterans hospital, that they can actually get a very high degree of high quality care by simply being able to interface through, really truly immersive telemedicine capabilities, which don't exist right now, but that's what we're all about, right? The university is all about looking to the future and trying to break barriers to make things better. And this is one way that we're going to be doing this through this college.
That's fantastic. One of the other questions that I had was, we have a very strong physician community here that's been involved with the previous, or with the current, but being phased out, College of Medicine in Chicago, University of Illinois, and we have a fantastic tradition. How do you envision physicians, leaders, and clinicians in our community and researchers being involved with the new College of Medicine? Because we would really like to be involved with the advocacy part, and many of us are connected in Washington and on very high-level committees within our specialties. How do you see us being able to be involved to support your efforts and work and in collaboration?
Right. So there's many facets to this. One I should thank actually the physicians who are involved with the existing college and the dedication to making sure that the students that are in that college are really well taken care of and are able to complete the degrees as planned and as they aspire to. You know, I think that's a tremendous commitment. I think it shows, and I know it's not only the physicians in the community, but also our faculty in the university and also at the University of Illinois Chicago. So that's very much appreciated. In my mind, this college has, you know, when you think about where it wants to go, I think, and in terms of the number of students that are likely to be involved, but also the potential for, I would say, an outsized research effort compared to, say, just the pure number of students involved, that there's going to be tremendous opportunities to partner with the community and the physicians to expose them to that. I also tend to think that, you know, it's one of these things where I have to believe that the college will draw from the excellence in community, if only because we're going to want to give the students the best possible opportunity to learn and to learn from the best. So you know, to the extent that talent's out there, we're going to aim to reach for it. Yeah. Yeah.
So that's fantastic. I really appreciate your involvement and dedication to this visionary college. And any other remarks you'd like to make?
Well, I'll just say, as you know, today was the announcement of the Board of Trustees' approval for our new founding dean, Dr. King Lee. I've had a chance to interact with him a number of times. I'm terribly impressed with him. I mean, he's very impressed with him. I think he's going to be fantastic for the college. I'm really looking forward to seeing him here and actually interacting with the community.
Yes, we're very much looking forward to it. It was a great day and wonderful. Thank you so much for sharing your expertise and information with our team.
Thank you very much.